Welcome, everyone. I'm excited to welcome you to this episode of the Sunflower Podcast, a podcast exploring all aspects of children's palliative care around the world. Sunflower Podcast brings curiosity, humor, and reflection to the world of palliative care. We explore the joys and challenges of working in this incredible field, including topics related to education, advocacy, self care, service provision, and leadership from around the world. Whether you're a nurse, counselor, pharmacist, doctor, or any other type of health worker, or just someone who's interested in learning more about children's palliative care, then this is the podcast for you. I'm one of your hosts, Dr. Spandana Rayala, and today I'm joined by Dr. Maria Liza Naranjo, a specialist in palliative care with a lot of interest, but also a champion of pediatric palliative care in the country of Philippines. So let's get started. Hello, Lisa.
Hi, Spandana.
Thank you. Thank you for agreeing to do this podcast with us. Can you tell us a little bit about your journey in palliative care and how it brought you into the world of pediatric palliative care?
Okay, so I always tell this hopefully to inspire other colleagues in the same profession. But first of all, some disclaimer. Maybe if you met me like more than 20 years ago, I would have run in the opposite direction when I hear anything about palliative care. Because medicine, unfortunately, training in medicine did not prepare me for this. So it was a long journey for me. So I'm actually a pediatric hematologist in the Philippines. And our way of training was really about procedures, diagnostics, and of course, curative intent. But along the way, there were instances that I felt I was shortchanging the children I'm seeing, the family I'm seeing, and even shortchanging myself in some situations that I felt so frustrated, especially when the curative intent is not going in that direction. So, of course, my mentors were really preparing me to be a hematologist, and I'm really grateful for my mentors who also allowed me to be responsible in developing patient support groups, which I think allowed me to see a better picture on how to engage with children and families, which is why there was a certain point, maybe like 15 years ago or more, that I felt I had to, I was questioning myself that there was something more that I can do beyond the training I got as a hematologist. And as I was looking around, I saw palliative care as like there was a course in the American Society of Clinical Oncology, like a short observership. And I was fortunate enough to be one of the pioneer batch of the ASCO PPC IDEA program. And of course, it was really an eye opener. Unfortunately, when I got back, I didn't really know who the palliative care community was. So, what I did was train and look for more opportunities for training. And it opened my doors to getting new people, whether international or local, and seeing where palliative care in the Philippines was maybe more than a decade ago. But I guess it's really about me asking, can I do something more? And most likely there is a structure, and palliative care provided that structure.
Thank you, Lisa. I think what you have said about run in the opposite direction is so true for so many healthcare professionals. Like everyone is like, no, no, I don't want to do this work, most of them at least, to begin
Yeah.
with. And then there is something that moves them towards that.
I
Thank
think
you.
it's
Uh,
really because we were trained that way, and it's more of like we didn't really know any better.
I totally agree. And also, once you see the benefits of uh, practicing palliative care or implementing the principles of palliative care, it's very, very difficult to unsee it. So I think sometimes it's
True.
also the demonstration of it that becomes very important. Lisa, you're one of the few people I have seen over many, many years who has stayed on the course that this is what I want for pediatric palliative care in my country, in my region. Working with you closely, I see that it's all finally coming together. At least that's what I feel. So what are your thoughts about it? Like, what are your plans, hopes for Philippines? What's happening over there?
So the Philippines is a unique experience or history in palliative care. We are actually very thankful that the family medicine practitioners who underwent further training in palliative care, we call the pioneers or the pillars of Philippine palliative care. And that led us to realize that there's a niche, a special niche for pediatric palliative care. So I think it was really prior to the pandemic, early 2000, that we were thinking that if we were want to pursue palliative care, especially for children, we had to connect with the pillars who were already doing it, which were the family medicine people. And I think having champions who have fought the fight for palliative care, especially in adult settings, allowed us a smoother transition in championing palliative care in the Philippines. And I'm happy that for the last few years, we found the right people who can champion children's palliative care, especially from the time that we had our hospital director who was really pushing us to develop this and was even open enough for a children's hospital at that to partner with family medicine, because in the Philippines sometimes we're so like institutional based that we're so close to not really collaborate outside our specialty. But I think that was the turning point, especially in National Children's Hospital, when even the director was so open minded that if pediatric palliative care will flourish, we had to first of all partner with those who are already doing palliative care practice. And I think that was the game changer at that point.
That is a huge leadership lesson I think people can take away, is that thinking about who are the collaborators, who are the
True.
champions, and
Mm.
bringing them all together. This reminds me of the African proverb. I'm just paraphrasing. When you want to walk far, you do it with others.
Mm.
Whereas when you want to walk fast, you do it alone. So you can see the progress happen so much over the years.
And I just like to add on that it's always good to engage, especially from the high up, because anything you do requires sustainability, and that can only be done when you have leadership support. And what's fortunate about us in National Children's, it didn't come from the bottom up, but it actually became from the medical director itself who challenged us, is there something we can do to address palliative care in children? So I think having that kind of mandate more or less smoothened the road. And then when people came in, especially the right people with the same vision, the same commitment, came on board, in that aspect, we were just lucky to have people who were with the right mindset in terms of palliative care and how it can move forward.
Yeah, and also I think it's not just serendipity in terms of people with the same mindset, but also probably you're filtering out people or filtering in people that match with the team's whole ethos. So I think that
Yeah,
works out too.
true.
So, in all this journey, how did this work intersect with your journey as a scholar in the leadership program? Can you tell us a bit about what your leadership project was along with that?
Yeah. So I think it was a the leadership project was really just something that was the next step for us, because to put it in context, we were in our fifth year as a pediatric palliative care team. And what it meant was we were able to develop the team in terms of doctors, nurses, an interprofessional team at that with social workers. And we were able to sort of institutionalize the services and create referral pathways within the community, which is in the hospital. We were able to do that through sensitization, numerous workshops, lectures, foundations for doctors, nurses, and social worker, even conducting our second symposium last year, which was attended by delegates nationwide, which was a good thing. So we felt that it was the natural step to take. The next step was really to create an accessible training program that is recognized locally to ensure that the workforce will be sustainable and can expand. So I made sure before I even deciding on what leadership project to take is to get the team's consensus. If this was after the last 5 years of doing things, doing services and training, would this be our next move? And when I got their go signal, I was confident enough to pursue the development of the pediatric palliative care fellowship training program, which we hope will eventually be launched this year, 2026 mid-year. So I think it's really more of like where we are at the moment for the last 5 years and what was our next step. So that led me to decide that this would be the project to pursue.
I think that is such a strong point when you have pitched your project and joined the leadership program, because I think the leadership program of Two Worlds was designed for children's palliative care in with the mind that we will help, we will support people go to the next level. So
Mhm.
there should be some foundational work that already exists so that you're building on it. But also sometimes some of them did end up doing foundational work itself as a leadership project.
Mhm.
So I think those
Yeah.
were the two kinds of things. But what I really like that you have said is, even though it was an individual project that you were pitching it to a program, scholarship, and everything else,
Mhm.
you went back to your team and brought their consensus in, because again, building a fellowship program is not going to be a one person thing. So
True, true. Actually, I had initially when I was telling, maybe I'm confident enough to lead this, having been exposed to some academic activities or training, but I was misled with the thought that it was just going to be developing a manual and that's it. I was totally wrong with that kind of perspective because it turned out that when you do develop a fellowship training program, it's not just going to be in paper. So it's not just going to be the curriculum itself, but you have to ensure that the program can actually be implemented and most importantly, be recognized, especially on a local level. Because it's good enough to have training, but I think the biggest gap we were seeing then, because we already have like fully trained pediatricians on palliative care through the TWCC fellowship training, the biggest gap we were seeing is that they were still not fully recognized or formally recognized by the Philippine Pediatric Society, which is the mother society of practitioners of pediatricians in the Philippines. So that was something we wanted to address, and we thought that having a locally based fellowship program would address that, which meant that before even starting the concept of a fellowship program, we had to get the buy-in of these people early on. Yeah, and that was one of the big lessons. The first big lesson I learned during this leadership project was really identifying who the people need to be involved and inviting them early on.
that is fantastic. And that leads me to my next question. Can you tell us a little more about what were your major learnings from the leadership project itself? Spending that 1 year working with many, many mentors, attending two in person workshops. What was most helpful to you during that time? But also, what were some of the skills that you think you have applied in your work?
Yeah. So, first of all, I'm really grateful for being part of the leadership program because leadership per se is a skill, again, never taught formally in medicine. So, sometimes we sort of pull some kind of leadership skill, whether from a high school project or something, but nothing ever formal. So, the leadership program allowed me to reflect on where I am right now as a leader, but at the same time, provided me the necessary tools, especially the frameworks, how to pitch, who to identify as stakeholders, how to plan out your project so that you can see key improvements as you go along. But I think majority of the lessons fell more on the relationality of projects or even initiatives, that it cannot be done in your own timeline. There always has to be a consideration that when you're talking about big projects, you always have to ensure that you don't push your own agenda, but ensure that when you're going through the process is you have to be more patient, you have to be more flexible. And at the same time, as I was always telling the team, you always have to have a plan B because as much as we were in a strict calendar deadline, we just realized that when you're talking about big projects, especially on a national level, you really have to besides being persistent, that you really have to be flexible with regards to your timelines.
Yeah. I think that's what I was thinking. Like, I agree with you. Like, I never received formal leadership training during my medical school nor my
Yeah.
postgraduate residency, right? Like, these
Yeah.
are some things you attend special courses or pick up from books, from people, and then special thing that none of us can access. And having these courses definitely makes a difference. But also, I really like what you said about it's not about your own agenda, but trusting the process. If we didn't have a structure before and now we have to follow through with the structure, I think that's the biggest challenge. Like going step by step instead of wanting to do everything at the same time. So thank you for that. So,
And I think, Spandana, just to add, I think, of course, having mentors really helped a lot. And they were the ones who sort of like tempered my expectations and allowed me to look at the project in different perspectives on how you can put it in phases instead of like developing or delivering the whole thing in 1 year, which is not necessarily something that can be done, but also the fact that you will always be on the lookout. You should always be at the lookout for opportunities that come. That's not in your agenda, but when the opportunity is there, you have to be ready to grab it. So that's something I think our team learned along the way. Yeah.
I have seen you do that, right? Like you utilize the International Children's Palliative Care
Mm-hmm.
Network's conference that happened in Philippines last year
Yeah.
to push lot of things for National Children's Hospital pediatric palliative care. You utilize the global experts' presence
Yeah.
and you pitched your ideas and you got a lot of buy-in from other partners. So I think that is fantastic.
We were just fortunate that 2025 was a big year for pediatric palliative care in the Philippines. So we sort of like rode along that wave.
Do you have any other thoughts, Lisa? Like, what are your big picture dreams for Philippines, and where do you see yourself and your team in the next 3 to 5 years?
Yeah. So I think for the last 5 years, we were building skills, expertise for palliative care. And along the way, we were unconsciously building the environment for it to really grow. But I think what we were trying really to focus now is to make sure that we go beyond clinical experience, but focus on things, especially on the system level, that can really support pediatric palliative care practice. And that would mean really continuously engaging with people who accredit the practice, people who can recognize the benefits as well as the proper compensations, especially in the practice of palliative care. And I think sustainability is one of the key things that we want to ensure. And of course, that would require some kind of proper framework in terms of the profession. And I'm talking about not just for doctors, but also especially for nurses and our social workers. And in fact, that's one of the additional gaps we're seeing as we move closer to our launching of the fellowship program is how to take care and ensure that our teams are protected given their current workload, which is for me is still the tip of the iceberg in terms of palliative care delivery. We still have a lot of expansion to do, but we're making sure that we would pace it as much as we can to ensure that we're not overloading our team. So it's more of like making sure that we're pacing it well, making sure that we're taking care of our team, making sure that we still move forward. As we move forward, we grow bigger in terms of support as well as taking care of each other. I think bottom line, I think that's the next step we're seeing is we want to expand, but we want to make sure we're taking care of each other.
Wow, love that. And I also love the piece about sustainability, where you're making sure these jobs exist within the system, these are recognized and they are
Mhm.
paid just like any other profession within the healthcare, right? So I love what you have said. And that is a huge challenge for the other countries that we work with. And it's very good to focus on a system level barrier and try to work on it because it does take a lot of time. And I loved how you all brought it all together and making sure your team is well taken care of.
Yeah. I think we realized at that certain point that passion and commitment can only go so far. We need to make sure that we can take care of them as they're taking care of people, especially those who are most vulnerable. So it's really, really more of like giving back to the people who can carry this forward.
I think that would be my takeaway from this talk, something I really want to think a lot more on. With that, I'll bring this recording to a close.
And always a pleasure, Spandana, for engaging with you. You're always one of our inspirations as well in the Philippines.
Thank you, Lisa. And it has been a wonderful, wonderful journey with your team, with you, watching you all do all these wonderful things, putting them in practice, and then thinking about sustainability and the time and investment that you put into this work. With our little energy that we have put into this, just seeing it all come together, I think we need to celebrate the next time we meet again.
Always excited to celebrate our milestones together.
Fantastic. Thank you for listening to this episode of the Sunflower Palliative Care Podcast. These podcasts grew from the seed of an idea as we talked with our colleagues in the Sunflower Children's Network. The Sunflower Children's Network is Two Worlds Cancer Collaboration's pediatric initiative. To learn more or to donate, please visit twoworldscancer.ca.